So my name is Michael Carter. I'm a consultant in Paediatric Intensive Care Medicine in Oxford, and I'm also a researcher at the University of Oxford, although I also collaborate closely with friends and colleagues across the UK and across Europe, particularly at Imperial College and King's College London. My area of research is on infection, inflammation, and critical illness as a paediatric intensive care doctor. I've taken quite a long path to get here. I was originally a zoologist, so I was really interested in entomology. That's how insects survive, live. And that took me into researching malaria. When I was researching malaria, I realized that I needed to be a clinician, not just a biologist. And so went back to medical school, retrained. I found pediatrics more and more interesting, more diverse than any other speciality. And I think if we look at the people attending the Congress, that's certainly the case. And then with that linked my infectious diseases and my pediatrics interests to go into pediatric intensive care medicine with a specialist interest in inflammation and infection. It's a hugely diverse speciality. I think there's nothing else within medicine where you can look after a newborn infant that maybe weighs 500 grams and is the size of your fist, and a 120 kilo 16-year-old who's had some major trauma. So I think it's really wise to explore the diversity of pediatrics. Of course, it also contains children who are ill with any organ system, whether it's renal or cardiac or respiratory, immunology. So I think, again, it's worth exploring just the age groups as well as the organ systems. And then finally, I think children are so interesting because their life course is so important, and getting it right at the start of life is so crucial for longevity of happy, healthy years. I think one of the great things about pediatrics is you can advocate for the whole of society, because the old adage of children make up 1/5 of society, but all of our future is very much true. I'm working on how mechanisms of severe organ dysfunction are similar across different critical illnesses. So, for example, a child with sepsis coming in with a severe infection might have capillary fluid leak, which we'll see as bulging of the soft tissues beneath the skin. And that might be quite similar capillary fluid leak to a child who's just had major cardiac surgery. So if we can understand how that mechanism works in, for example, major cardiac surgery, we might be able to treat that mechanism better in patients with sepsis, and vice versa. If we can understand how inflammation in sepsis works, we might be able to treat patients with major cardiac surgery better. So I think there's a lot of things to be joined up within pediatric critical illness, and I see my role as doing that. The main focus of my presentation in Lisbon in October will be on what are called endotypes. Endotypes are groups of children who may have very different causes of illness, but they behave in a similar way immunologically. And we describe that on the basis of how genes are expressed. So, for example, one group of patients in endotype 1 might, for example, have a lot of genes that are expressed by neutrophils, and another group of patients, which we might say are in endotype 2, might have a lot of genes that are expressed by T cells. And those two groups might behave quite differently. They might spend longer on a ventilator, they might spend longer having renal replacement therapy, and they may die at different rates. And if we can understand what the biology underpinning that is, then it might be that we can treat the biology differently. I'm really interested in neutrophils and something called emergency granulopoiesis, which is when the body spits out immature neutrophils in an effort to fight infection. But actually that mechanism seems to happen as well after surgery, after trauma. And it may well be that that mechanism can be modulated. And that's something that we're really focused on, is then looking at inflection points that might move patients from an unfavorable endotype to a more favorable endotype and then improve outcome. Events like this help in two ways. One is they spread ideas, and I think that's really important. For example, the work I'm doing might well be relevant to people who are looking after patients with infection, and to people who are looking after patients with cardiac surgery or trauma. And so those ideas spreading are really important. But the other thing that I'm proud to be involved in is the ability to share people and expertise between places. So, for example, one of the things I hope would come out of this is that researchers from one group go and spend time with researchers from another group across Europe and beyond, so that we can share expertise not just as ideas but as people bringing new techniques. That way we all improve, and it becomes a virtuous cycle of improvement for our patients, which is fundamentally what the whole thing is about improving care for our patients. I think I'm most excited about something that I don't yet know. I know that I will get there. I'll go to some lecture that I wasn't planning on going to because it was on and because I was walking past and it looked like an interesting title. And it's that accidental collision with something that I didn't appreciate before that is the most exciting bit about EAPS. It's not just a small group of people talking about the same old stuff. For example, the last one, the lecture that really blew me away was on respiratory medicine and the use of PEEP in patients who are invasively and non-invasively ventilated. And understanding the physiology of that was really great. The message I'd like to share most in the paediatric community is that we are in a troubled time, a time where people are becoming more siloed in their own nation groups. And I think attending these European conferences is incredibly important in order to break that down and prepare for improvements which will come in the future years. Thank you for listening. Really, really excited and seeing you there in October at EAPS. And please come up to me with your questions, ideas, and we can talk further then.